Hi, this is Paul Palmer. Yesterday, I posted a video about my experiences in a remote audit, and one of the comments raised raised a query about whether you can be confident in doing a remote audit or whether you really need to go on site. And it made me think about trusting people. What do you need to be able to trust them? Because the question was, when you're doing a remote audit in pharmaceutical supply chain, how do you know if they're taking the camera around that they're showing you everything? How do you know they're not dodging around something? How do you know they're not got it all pre-prepared and they're just showing you the odd bits that they want to show you and not something else? And to me, it's a bit about trust. Do you have a good relationship? Does it feel right? The actual audit, the atmosphere, are they being supportive? Are they being helpful? I do remember previous audits where the client, the auditee, not really client, was being quite obstructive and attempting to stop you looking at anything and everything that they could. And I remember other audits where the auditee has been as helpful as possible and they're actually looking to get as much out of the audit as they can. And it is about whether you feel like you can trust them or not. And if you feel like you can't trust them, well, you're going to dig deeper when you find something that looks like at the top level, there's potentially a problem with it. Whereas if you do trust the auditee, then the likelihood is you're going to look at it at the top level and you're going to listen to their explanation and accept their explanation on what it is that you've told them about it, or they've told you about it. Sorry, they've described where they see the concern, how they understand it, and what's underlying. And maybe there's a system underneath that they're following, and maybe there isn't. But you've got to the point where you've trusted them enough throughout the audit, throughout the evidence that they've already presented, that you've formed a level of trust in them. And I feel that within the pharmaceutical supply chain, you have a chain of trust. And if within the supply chain you can't trust your suppliers, at least to some extent, I know we're going over to do our due diligence and we're checking their procedures, we're checking their records, we're looking at what they're doing in the plant, maybe in the warehouse, maybe on the routes, and you gain a level of trust because even if they are dodging around something, well, you're only there once. Maybe you're there once every year or 2 years or 3 years. And in between times, you're not going to be looking at every single thing they do. So you do have to develop a level of trust. So during the audit, you want to see a level of openness. You want to talk to them and develop some sort of rapport and get to the point where you really believe that they're telling you the truth. And the trust is supported by the SOPs that you read and the records they deliver to you and what you see on the audit. And at the end of the audit, you know whether they've passed or not. Even before you've written it up, you know whether there's sufficient trust between you and them, a good level of understanding. I've been in situations before where I knew I couldn't trust the company that I was auditing. They didn't have a clear understanding of why they needed a quality. I can't remember if it was a manager or a director. But the responsible quality person wasn't on site for the audit. He was at home sorting out the documentation. Well, that wasn't very good. Why was he sorting out the documentation? Because he'd been fired. Okay, he'd been fired. So who was taking on the role? The person that was taking on the role was in operations, so no independence for a start. But my biggest concern was they didn't understand the quality system. They didn't have a clue about GMP, about GDP, about why we needed things doing a certain way. They didn't understand change control. So I knew at that point, I was confident that we couldn't rely on them. We couldn't trust them to do the job we needed. This was printed packaging supply, it wasn't manufacture. But they didn't get it. They didn't understand our expectations. So until they replaced the role, quality role, with somebody who had a good understanding, we couldn't use them. So I declined them as a supplier. So when you're in the supply chain, whatever role you're in, you need to be able to trust your colleagues. You need to be able to trust your companies you work with. If you can't, then the likelihood is you can't continue whatever it is that you're doing. GMP, GADP, pharmaceutical manufacture and supply. We have to be confident in the competence of the people we're working with. We have to trust them. That's it for me for today. It's Paul Palmer. Talk to you soon.